Madam President, I wanted to speak to a couple issues this evening. The first one has to deal with what we understand to be the evolving so-called deal that is being worked out by the other side on the, quote, public option / government plan, and the attempt to try and reach 60 votes on the other side, and what appears to be a process that continues to just sort of unravel and break down, because every single day there's a new story about some new gimmick that's been thrown out there to attract the requisite number of senators to be able to get to that threshold of 60. And the most recent one, and of course, like I said, I can't verify any of this because we haven't been privy to or included in any of the discussions that have occurred behind closed doors. And in fact, one of those meetings just occurred earlier this evening. But we read from press reports that one of the proposals that's now being contemplated by the majority to try and get that requisite number of votes is an expansion of the Medicare program. And what's interesting about that, of course, is that that has engaged organizations that prior to this time had essentially been at the table and negotiated their own kind of agreement. But that's gotten the interest level up of the American Hospital Association, the Federation of American Hospitals, the AMA, the physician group, and even have something here from Mayo Clinic. But I thought it's interesting that that would be considered now as an alternative to what previously had been discussed in terms of a public option. And here's why. Medicare, as we all know, is destined to be bankrupt in the year 2017. It is a very large program that benefits a lot of seniors across the country. We all support reforming it, making it more sustainable, putting it on a pathway and to where it will be solvent well beyond that date and extending its lifespan. And what this would appear to do is allow people younger than 65 or 62 down to 55 to buy into Medicare. And essentially what you do is you would allow more people to participate in the program, in a program that, as I said before, is destined to be bankrupt in the year 2017. And so what you're doing with this proposal, because we all know that the underlying bill cuts Medicare reimbursements to hospitals and nursing homes and hospices and home health agencies and to Medicare Advantage beneficiaries by about $1 trillion over 10 years when it's fully implemented. So you're going to take $1 trillion of revenue out of Medicare. And then, and this is, remember, Madam President, this is a program that's already destined to be bankrupt in the year 2017. So you're going to take $1 trillion of revenue out of it over the 10-year period when it's fully implemented, and expand and add the number of people who are going to be on it. The equivalent is just like putting more people on a sinking ship. And in fact, that's what's gotten, I think, the attention of all these various organizations and the provider groups around the country, because hospitals, as we already know, can't recover their cost with the reimbursements that they're currently receiving under Medicare. In most states, it varies a little bit, but 80 to 90 cents on the dollar. So for hospitals who are losing money every time that they serve a Medicare patient, what they do is they shift that cost over to the private payers, and that increases the cost for everybody who's receiving their insurance in the private market. So essentially what you would be doing is expanding the government-run Medicare program, which under-reimburses hospitals and physicians and other healthcare providers, and forcing even more of a cost shift. You're exacerbating the cost shift that's already occurring, making it worse, and in fact, getting all these provider groups, the American Hospital Association, the American Medical Association, engaged in this debate because they see what a train wreck it would be for them. And frankly, what that means is you'd have a lot of providers who wouldn't be able to make ends meet, and it would put them, they would have to shut their doors and go out of business because many of them are very dependent upon Medicare patients. And I say that in my state of South Dakota, most of your hospitals, especially in rural areas, are heavily dependent, 70% thereabouts on between Medicare and Medicaid. And if they're not a critical access hospital and they're still getting reimbursed under the traditional Medicare program, they're going to have a very, very hard time making ends meet, because right now what they do is what all hospitals do, and that is they shift costs over to the private payers. Now, here's what the AMA said about that proposal. The AMA has long-standing policy opposing the expansion of Medicare given the financial projections for the future. That's what the doctors group has said. The American Hospital Association has urged all senators to reject expansion of Medicare and Medicaid as part of a public option. saying that Medicare pays hospitals just 91 cents for each dollar of care provided. And this, again, it would expand the number of people that they would have to cover and shrink the private payer market and lump more and more of the cost on those, and so everybody else's premiums would go up. The Federation of American Hospitals, which is the private hospitals across the country, said any Medicare buy-in would invariably lead to crowd out of the private health insurance market, placing more people into Medicare. Such a policy will further negatively impact hospitals after we have already agreed to contribute the maximum level to sustainable reductions in the deal that they, as I said, struck earlier. But it seems to me that these deals now have all sort of fallen off the table. And this latest proposal, if in fact this is what we're reading is true, I think they recognize would be a disaster. Now, here's what Mayo Clinic in their letter said: any plan to expand Medicare, which is the government's largest public plan, beyond its current scope does not solve the nation's health care crisis, but compounds it. And they go on to say expanding this system to persons 55 to 64 years old would ultimately hurt patients by accelerating the financial ruin of hospitals and doctors across the country. A majority of Medicare providers currently suffer great financial loss under the program. Mayo Clinic alone lost $840 million last year under Medicare. As a result of these types of losses, a growing number of providers have begun to limit the number of Medicare patients in their practices. That, Madam President, is what we are talking about. If you expand this program and you have a reimbursement system that currently does not cover the costs of hospitals, they are going to cease covering Medicare patients in the same way that they're currently not covering Medicaid patients. They say about 50% of physicians today have chosen not to accept Medicaid patients. And so you compound the access problem that many people in rural areas already experience. And so these are the big problems with this. And I have to come back to what Congressman Anthony Weiner said about this. He said, extending this successful program to those between 55 and 64, a plan I proposed in July, would be the largest expansion of Medicare in 44 years and would perhaps get us on the path to a single-payer model. Therein, Madam President, I think lies the ultimate goal of this, and that is to expand Medicare to where we have a whole government-run health care system in this country on the way to single-payer status. That is precisely what many of our colleagues on the other side want to see happen. Now, ironically, there are some who have expressed concern about this. Our colleague from North Dakota, the chairman of the Senate Budget Committee, Senator Conrad, said, when asked about this proposal, it's got many of the same problems I have with previous versions of the public option. He went on to say that it ties you to Medicare levels of reimbursements for a whole new population, and he contended that the hospitals in his state would go bankrupt. Well, his state, North Dakota, is not unlike my state of South Dakota. Hospitals are not going to be able to make it if these reimbursement levels that are currently afforded them under Medicare are extended to a whole new population. And so, Madam President, I hope this is a bad idea that is just being thrown out there as sort of one of these things that's being thrown at the wall and hoping that it sticks in a desperate effort to get to 60 on the other side, because this really is a bad idea, and the provider groups are weighing in heavily against it. And I think it's pretty clear that it would be a disaster for health care delivery in rural areas of the country, and for that matter, Mayo Clinic and many of the other providers who have weighed in on this. It would literally, I think, make it more difficult for people to have access to health care and certainly exacerbate the cost-shifting issue that already exists with regard to the private payer market, make their costs and everybody else's costs go up even more. Madam President, I want to shift gears for just a moment because tomorrow Senator Hutchison and I will be offering a motion to commit. And basically what it deals with is the whole tax component of this health care reform bill. And in very simple terms, and I want to show you exactly why this is a relevant issue, because if you look at what the cost of this program, this health care proposal is, the Reid proposal before us, and you can see what the costs are in the early years, and then you can see how the costs explode in the out years. Well, there's a reason for that. The revenues kick in right away. The tax increases start coming in right away. The spending proposals and many of the benefits that will go out under this bill don't occur until much later. And so what you have is a 10-year picture, budgetary picture, and cost for this program that way completely understates what the true cost of the program is. And so if you look at this particular chart, you look at the years 2010 to 2019, you can see how, particularly in the early years, it doesn't look like there's that much spending. And in fact, the number in the first 10 years is $1.2 trillion in spending. However, Madam President, if you look at the cost of this when it is fully implemented, you take the year 2014 and extend it through the year 2023, you can see how the costs explode. And the fully implemented cost over a 10-year period is $2.5 trillion. And there's a reason for that, as I said. A lot of budgetary gimmicks were used to understate the actual cost of this, particularly in the first 10 years, so that people could come in and say, it's only $1 trillion. Well, in fact, as you can see, when it's fully implemented, it's $2.5 trillion. Well, the reason for that, one of the reasons at least, and one of the major reasons, is because the tax increases in the bill take effect 23 days from now. January 1 of the year 2010, many of the tax increases in this legislation go into effect. Now, the spending and the benefits that are going to be distributed under this, the exchanges and the premiums, the premium subsidies and that sort of thing, tax credits, don't begin to kick in until the year 2014, 1,484 days later. So for all those 1,484 days, or back out, I'm sorry, the 23 days from that, so 1,461 days, taxes are going to be assessed and levied on people across this country, on small businesses and families and individuals, but you're not going to see any benefits for over 1,000 days, almost 1,500 days. And so what my motion to commit, and I'd say Senator Hutchinson, it's the Hutchinson-Thune motion to commit, does is it aligns the tax increases, the fees, the taxes that are included in this proposal with the benefits in terms of timeline, so that the tax increases and the benefits occur at the same time. In other words, we would delay the tax increases in this bill until such time as the benefits package and structure would kick in, so that they are in sync. Because right now you've got essentially 4 years, at least 4 years now, of tax revenues coming in, tax increases that are going to be borne by people all across this country, including businesses, which incidentally, there's a lot of discussion right now about job creation and the need to grow the economy. And the worst thing that you can do to small businesses when you're trying to create jobs is levy new taxes on them, which is what this bill does. And by the way, in that first 4 years, almost $72 billion of taxes will be collected. I say the first 4 years, I think that's through the year 2013. But you've got all these taxes that kick in on January 1 of 2010, less than 23 days now from here. And then actually you've got this amount of time, as I said, almost 1,500 days before the benefits begin to pay out. All we're simply saying is in our motion to commit is let's align the tax increases in this and the benefit structure so that you don't have this period of 4 years where people are paying taxes and receiving literally no benefits under this health care reform bill. And the advantage that has is it does accurately reflect the cost of this program in the first 10 years rather than understating it because of the revenues that kick in immediately and the benefits that don't kick in until much later. And so it's a very straightforward, it's very simple, very understandable. Tax increases that are designed to kick in on January 1 of this year would not kick in until such time as the benefits kick in. And so the fees and the taxes and the tax increases in this bill are all aligned and synced up, so to speak, with when the spending under the bill begins. And of course, what that does is it gives us a more accurate, I think, reflection of the overall cost of the bill. Now, many of these tax increases, Madam President, which will kick in 3 weeks from now, or a little over 3 weeks from now, on January 1 of this year, are going to be distributed across a wide range of businesses, but most of which are going to be passed on to consumers across this country. And in fact, the CBO, in a letter to Senator Evan Bayh on November 30th of this year, said essentially that all these fees, and there are fees on medical devices, there are fees on prescription drugs, there are fees on health care plans, all kinds of fees and taxes in the bill. And the CBO wrote in response to a question from Senator Evan Bayh that these fees would tend to raise insurance premiums. And in testimony in front of the Finance Committee, the CBO, when this question was posed during the deliberations at the Finance Committee level, was asked, what would all these fees do to insurance premiums? And they said roughly it would increase premiums dollar for dollar. So you've got these tax increases and these fees that kick in immediately, which will begin to have an upward impact on premiums. So people across this country will begin to see those premium increases take effect. The tax increases, of course, are taking effect on medical device manufacturers and on prescription drugs. There's a whole other range of taxes in here. There's the tax on high-cost plans, insurance plans. There's a health insurer fee. There's a Botox tax, which starts January 1st of 2010. And you can kind of go down the list. There are limits on FSAs, flexible spending accounts, which is something that people use to put aside money so that they can buy a high deductible plan and have dollars available to deal with the incidental health care costs that they have. And so the taxes are going to go up on those, and you can kind of go through this whole list of taxes, all of which, as I said, are going to kick in the near term, and none of the benefits kick in until many years later. But unfortunately for the American public, they're going to see the premium increases that will come as these taxes are imposed on all these various sectors of the healthcare economy, all of which will be passed on to consumers in the form of higher premiums. And so the American consumer, the American public, the taxpayers of this country are going to see the cost immediately and won't see the benefits for 5 years. That is not fair. It's not the right way to set policy here in Washington, D.C., and it's much more transparent if we have these dates, the tax increases and the fees and the taxes in this bill, synced up, synchronized, aligned with the benefits when they begin so that everything starts at the same time. So the motion to commit, again, Madam President, very simply, is a motion to commit this thing back to the Finance Committee to create a level playing field where the revenues that are raised under the bill don't begin to kick in until the benefits start to kick in and the spending starts to kick in. That will give us the true picture, actual picture of the cost, which, as I said before, is $2.5 trillion over 10 years when it's fully implemented, not the $1 trillion or under $1 trillion that's being used by the other side, because you have to look at this full picture over a 10-year period when it's fully implemented, and obviously that gives you a very different perspective about the overall true cost of this particular proposal. Madam President, we have in front of us, just generally, the basic contours of this bill have not changed, nor do we expect them to change. They will tweak around with this government plan. They will, I think they will probably, there was already a vote on the issue of abortion, which I happen to believe that taxpayer funds should not be used to finance abortions. We've had that vote. There will be some other votes on individual aspects of this. But some of those things are not going to affect the fundamental core elements of this plan, which have stayed the same throughout the entire process. And those core elements are a massive expansion of federal spending, $2.5 trillion over 10 years when it's fully implemented, massive cuts to Medicare, about $1 trillion over 10 years when fully implemented. And again, that affects hospitals, nursing homes, home health agencies, hospices, and beneficiaries of Medicare Advantage, of which there are about 11 million across the country. And it's also financed with increases in taxes, which I have just mentioned. Those are the basic components of this bill. 70 new government programs called for, all the new spending, all the new bureaucracy, all the new taxes, and all the Medicare cuts. Those things have not changed since this thing first started being debated several months ago, and that's where we are today. And that's why I believe this is such a bad proposal for the future of this country, because even after all that, if you look at the impact that it has on premiums, according to the Congressional Budget Office, 90% of Americans end up the same or worse off. And when I say the same, I mean year over year increases in their insurance premiums that are double the rate of inflation. So if you're buying in the small group market today or in the large group market, according to the Congressional Budget Office, you're going to see your insurance premiums continue to go up over time. If you buy in the individual market, you're going to see them continue to go up, but way more, by 10 to 13% increase in premiums for people who buy in the individual marketplace above and beyond the rate of inflation. that will impact people in the large and small group markets. And so bottom line is, if you're looking for reform, if you're the average American citizen out there and the person that I represent in South Dakota, when they hear the debate about health care reform, to them I think it means a couple of things. It means affordable access to health insurance for people across this country, and something that most of us, I think here, at least on our side, think ought to be a part of this, and that is measures, proposals that actually bend the cost curve down rather than up. And what we have seen consistently throughout the course of this debate is, with all the spending and all the tax increases and all the Medicare cuts, no positive impact on premiums. The best that you can hope for 90% of Americans is to maintain the status quo, to stay where you are, which is double or increases year over year, double the rate of inflation in your health insurance premiums, or worse yet, increases of 10 to 13% above and beyond that. That is what 90% of Americans are looking at as a result of the healthcare reform proposal that is currently before the United States Senate. There is a better way, Madam President, and we believe that the way to get this right is to start over and to actually focus on solutions that will drive down the cost of health insurance, that will bend that cost curve down, interstate competition, allowing pooling for small businesses, medical malpractice reform. We have a whole series of things we think represents the consensus view of people in this country. It's common ground that we can all stand on, but regrettably we've not been included in any of the discussions, nor have any of our ideas been a part of those discussions. Rather, they have chosen to pursue this course of a big spending program with the higher taxes, the Medicare cuts, and the higher premiums. So, Mr. President, I really, truly hope that there will be support for, as this process moves on and we get to these critical votes that are ahead of us, a more rational, step-by-step approach, doing this right, getting away from this huge, massive expansion of the federal government here in Washington, D.C., and seriously focusing on solutions that actually do bend the cost curve down, that don't rely on these huge cuts to Medicare, that don't rely on these huge tax increases, but actually find savings, and they can be achieved in the market by putting policies in place that will constrain costs and put downward pressure on the prices that most people pay for health insurance in this country. It can be done, Mr. President, but it's going to require some boldness on the part of some of our colleagues on the other side. I think our side is pretty well united that this is a really bad policy, a really bad prescription, if you will, for America's future. But we're going to need some help from a courageous Democrat or two to make sure that this massive expansion of the federal government is defeated, and that we can go back, start over, do this in a step-by-step way, in the right way, and in a way that actually does lower costs for people in this country. I certainly think that's what my constituents in South Dakota expect. I think that's what most Americans expect, and they deserve to have health care reform that gives them that outcome: lower costs and access to affordable health care. Mr. President, I yield the floor.